Hello all, welcome back to my channel. So today let us cover a few topics under Unit 1, concepts of community health and community health nursing. So first let's see public health in India and its evolution. So here it talks about excavation in the Indus Valley at Mohenjo-daro and Harappa around 3000 BC, where well planned cities with drainage, houses, and public baths of baked bricks were found. This indicates that ancient people used to practice environmental hygiene and sanitation. Also, it talks about philosophy developed on spirituality concepts during the ancient period. The ancient science of life is Ayurveda. So here Charaka described two objectives of medicine that states preservation of good health and fighting diseases. Ayurveda stressed the importance of healthy way of life, including cleanliness. So this is how public health evolved. It also covers hygiene, good diet, proper behavior, and mental and physical discipline. Cleanliness and hygiene were observed in everything, such as Jalasuddhi, pure water, Ahara Suddhi, clean food, Deha Suddhi, clean body, Mana Suddhi, pure mind, and Desa Suddhi, clean environment. Also, Ayurveda suggests the medical professional to treat a patient as a whole. Charaka Samhita recommends a comprehensive code of conduct. The religious teaching of Buddhism and Jainism dominated the 600 BC 600 AD era. The ancient universities of Taxila and Nalanda adapted medical education during this period. During the British rule, many small dispensaries, large hospitals, and medical institutions were established in India. In the first half of 20th century, public health, educational, and research institutions was established in the British rule itself in India. The purpose of these institutes was to conduct public health training and research in the area. After freedom, Indian government introduced several national health programs and reinforced public health systems with various 5-year plans. You can see few of the 5-year plans and programs mentioned below. So let's see some important milestones from middle of 18th century to 21st century. So in the beginning, in 1825, Quarantine Act was circulated. 1859, a royal commission was appointed to examine the cause of harmful conditions in the British Army posted in India. In 1869, Public Health Commissioner and Statistical Officer was appointed with the Government of India. 1873, Birth and Death Registration Act was circulated. 1881, First Indian Factories Act was passed. 1885, Local Self-Government Act was passed. 1896, Government of India appointed a Plague Commission to improve the public health of India. 1897, Epidemic Disease Act was circulated. 1907, Central Malaria Bureau was established as Kasauli. 1911, Indian Research Fund Association, now it's called as ICMR, which was established for the research work. In 1918, Reading Health School was established in Delhi. Also, one of the other, the Nutrition Research Laboratory was established. 1920, Municipality and Local Boards Act was passed. 1930, All India Institute of Hygiene and Public Health was established. 1931, the Indian Red Cross Society established a Maternal and Child Welfare Bureau. 1935, all the health activities in India were grouped under the control of central cum provisional government. 1939, Madras Public Health Act was passed. Tuberculosis Association was established. First Rural Health Training Center was established. 1940, Act was passed. 1943, Government of India appointed a Health Survey and Development Committee, Boer Committee. 1946, the Boer Committee submitted its report, and you can see some important milestones in post-independence era as well. So it's given over here. In 1947, ministries of health were established at the central and state government levels. 1948, India joined as a member state of WHO. Employee State Insurance Act was passed. Report of the Environment Hygiene Committee was published. 1950, Government of India established a planning commission. Central Food Technological Research Institute was established in Mysore. 1951, first 5-year plan began. BCG vaccination program was launched. Central Drug Research Institute was opened at Lucknow. 1952, Community Development Programs was launched on October 22nd, 1952. A virus research center was established at Pune with the joint help from ICMR and Rockefeller Foundation. Indian Cancer Research Center at Bombay was inaugurated. 1953 National Malaria Control Program was launched. National Smallpox Eradication Program was launched. National Wide Family Planning Program was launched. Family Planning Research and Program Committee was established. 1954 Contributory Health Services Scheme was started in Delhi. Central Social Welfare Board was established. National Water Supply and Sanitation Scheme was started. National Leprosy Control Program was launched. BDRL antigen production was established in Kolkata. Food Adulteration Act was passed by the Parliament. 1955 National Filaria Control Program was launched. Central Leprosy Training and Research Center was established at Chengalpet in Tamil Nadu. National Tuberculosis Survey was started. 1956 second 5-year plan was started. Chemotherapy center at Chennai was started. Director for family planning was appointed. Central Health Education Bureau was established. 1958 National Malaria Control Program was changed to National Malaria Eradication Program. National Tuberculosis Survey was completed. 1959 Mudaliar Committee was appointed to review the progress in health since the Board Committee's recommendation. Rajasthan became the first state to introduce Panchayat Raj. National Tuberculosis Institute was established at Bangalore. National Research Laboratories at Kannur was shifted to Hyderabad. 1960, School Health Committee was formed. Pilot projects related to smallpox eradication program were started. 1961, the third 5-year plan was launched. Mudaliar Committee's report was published. 1962, Central Family Planning Institute was established in Delhi. National Smallpox Eradication Program, National Goiter Control Program, National School Health Program, and District Tuberculosis Control Program was launched. School Health Program was started. 1963 Applied Nutrition Program was launched. National Institute for Communicable Diseases and was established. National Trachoma Control Program was launched. National Contributory Health Service Scheme was changed to Central Government Health Schemes. Family Planning Program was changed to an Extension Approach Scheme. 1964 National Institute for Health Administration and Education was established in Delhi. The Union government set up a committee under the chairmanship of Shantilal Shah to study the issue of legalizing abortions. 1965 IUCD was introduced. Direct BCG vaccination program was launched. 1966 Ministry of Family Planning was appointed under the Ministry of Health. A separate department of family planning was constituted in the Union Ministry of Health to coordinate family planning program at the center and state. 1968 Government of India appointed the Medical Education Committee to study the aspects of medical education. 1969 the fourth 5-year plan was launched. 1970 All India Hospital Family Planning Program was launched. The Birth and Death Registration Act was passed. 1971 Medical Termination of Pregnancy Bill was passed. Government of India appointed an expert committee to draft suitable legislation on air pollution. 1972 Medical Termination of Pregnancy Bill was passed. National Service Bill was passed. National Program of Minimum Needs was incorporated with health services. 1974 the fifth 5-year plan was launched. It was designed as the year of world population by the United Nations. 1975 India was declared free from smallpox on July 5th. Integrated Child Development Scheme was launched in India. National Children's Welfare Board was established. 1976 Indian Factories Act was amended. Central Council of Health proposed a three-tier plan of healthcare delivery system to rural areas. National Program for Prevention of Blindness was formulated. 1977 International Commission declared that India has eradicated smallpox. National Institute of Health and Family Planning was formed. Community Health Worker Scheme was started by the Union Ministry of Health. 1978. Also, in 1977, WHO adopted the goal Health for All. 1978, the slogan Health for All by 2000 AD was introduced at the Alma Ata Declaration in USSR. 1979, the theme of the year was the Year of the Child all over the world. 1981, the theme of the year was Year of the Disabled around the world. 1982, the new 20-point program was announced. The Government of India announced its national health policy. 1983, India launched a national plan of action against avoidable disablement known as Impact India. Guinea worm eradication program was launched. National health policy was approved. 1984, Bhopal gas tragedy occurred. The Workmen's Compensation Act 1984 was passed on July 1st. Juvenile Justice Act 1986 was passed. 1985, 7th Five-Year Plan was launched. Universal Immunization Program. A separate department for women and child development was established at the Ministry of Human Resources Development. 1986, the Environment Act was circulated. 1987, new 20-point program was launched. India Standards Institution was renamed as Bureau of Indian Standards. Safe Motherhood program was launched. National Diabetes Control Program and National AIDS Control Program was launched. 1989, Blood Safety Program was launched. 1990, Control of Acute Respiratory Infections was launched. 8th Five-Year Plan was launched. Child Survival and Safe Motherhood Program was launched. 1993 Revised National TV Program with DOTS was launched. National Nutrition Policy formulated. 1994 Plague returned after 28 years of silence. 1995 ICDs was renamed as Integrated Mother and Child Development Services. 1996 Pulse Polio Immunization Program was launched. 1997 Reproductive and Child Health Program was launched. Ninth Five-Year Plan was launched. 1998 to 1999 National Family Health Survey was commenced. National Malaria Eradication Program was renamed as National Anti-Malaria Program. 2000 Government of India announced National Population Policy. India was declared as Guinea worm free country. In 2002, Government of India announced National Health Policy. 2002, Government of India announced National AIDS Prevention and Control Policy. 10th Five-Year Plan was started. 2003, National Vector-Borne Disease Control Program was started. 2004, Vande Mataram scheme was launched. Antiretroviral treatment was started for HIV patients. Integrated Disease Surveillance Project was launched. 2005, National Rural Health Mission was launched to promote rural health India. Also, Janani Suraksha Yojana was started. Reproductive child health 2 phase was started. 2006 Integrated Management of Neonatal and Child Health Illness was launched in 16 states. 2007 11th Five-Year Plan was started. Ayush Medicine System was started. Indian Public Health Standards for PHC and Subcenter was formulated. 2008 National Health Insurance Program was started. Non-communicable disease program as pilot project launched. 2009 pandemic influenza H1N1 2009 outbreak reported. 2010 ICMR released guidelines for daily nutrient and energy. First phase of measles catch-up campaign begin in India. 2011 Janani Shishu Suraksha Karyakaram was started. Last case of poliomyelitis reported from West Bengal. 2012, 12th Five-Year Plan was started. Janani Shishu Suraksha Karyakram launched. NSSK launched. 2013, National Health Mission was started. 2014, India was announced polio-free country. Pradhan Mantri Jan Dhan Yojana was started. 2015 Swachh Bharat Abhiyan was launched. 2016 Sustainable Development Goals was launched. Malaria Eradication Plan was launched. Pradhan Mantri Jan Ayushadi scheme was launched. 2020 the pandemic COVID-19 initiated a worldwide response that included lockdown, test, contact tracing and vaccination programs. I'll share the remaining topics in my next video. Thank you so much for watching.